Okay, thank you so much for allowing me to speak today. Before I do begin too, I'd like to acknowledge the Wurundjeri people from the Kulin Nation here, from where I present. Acknowledge that the land was never ceded, and I look to them with great respect to guide us in the future. I'm actually going to share with you an outline of what I'm going to give to you today. And it was about a project that I was involved in last year. And I'll give you the situation and the task at hand and the action that we took and what the results were, what were the challenges, what were the pitfalls, and what are the realistic expectations that can be placed on us, both consumers and researchers alike, to work towards embedding co-production in everything we do together. So before we look at the project, I just wanted to look at co-production a little bit, just to see what it is, kind of, and perhaps what it is not. So there's a myriad of descriptions attempting to define what co-production is, and sometimes it's used interchangeably with terms such as co-design, for instance, and Erin did a brilliant presentation just now talking to us about co-design. It was fantastic. But rather than concentrating on specific definitions, and some can be pretty abstract. I don't know if you've done a little bit of a search on the net for the description of it, but it might be more useful to look at co-production not as a model or a thing, but as an action or a process that is constant. So there's a research or a resource, I should say, that comes to mind that's produced by the Social Care Institute for Excellence on Co-production that's useful in this context. So according to the SCIE, in their resource entitled Co-production, What It Is and How to Do It, the Institute states that co-production is basically a set of activities. So co-designing, which Erin just spoke about, including planning of services, maybe, as in our case, research, co-decision making, like in the allocation of resources, for instance, co-delivery of service, in our case, research projects once again, and also co-evaluation. So another useful definition, which I like, it actually comes from the UK's National Institute for Health Research Principles and Success Factors for Co-producing Research. So it's the sharing of power, where research is jointly owned and people work together to achieve a joint understanding. This is something that's been recurring not only in Richard's introduction, but also in Erin's as well. And it's something that we all need to continue to explore. And it can actually be quite self-effacing or self-effacing, some people say it like that, to actually consider and always readdress the sharing of power. It includes all perspectives and skills, where the research team includes all those who can make a contribution. Everyone is of equal importance. Again, another one that can be challenging for all of us and that we constantly need to address, respecting and valuing the knowledge of all those working together. Reciprocity, where everybody benefits from working together. Building and maintaining relationships, where there's an emphasis on relationships with a focus on joint understanding and consensus and clarity over roles and responsibilities. So I'm going to take all those things that I just talked about, and I'm going to share with you a project that I was involved in last year that might illustrate these things a little bit further. So this was the project. It was a priority setting project, this orange part is that you can see on that slide. And it was required as the first step in a larger body of work. So the outcomes of this step were to inform the set of guidelines for 9 funded research projects. Now, which in turn became the guiding principles that needed to be present in the co-production research applications for successful funding. And then hopefully it would make up part of the shared purpose in the research projects that just got underway earlier on this year. Okay. So initially, a project manager and a supporting senior academic and a team of senior academics were going to be doing this section of the work, but I pointed out to them that in the true spirit of co-production, that perhaps you need to involve consumers right from the very start. So they invited me to join at this stage as the consumer lead. And so I partnered with a project lead and an academic lead. So our task was this. It was a multi-pronged approach to involve as many varied voices that we could possibly muster across the country. And that was to develop a ranked list of research priorities. This is kind of the standard way that you go about, working on what the priorities are for your projects. So research priorities and your set of criteria that would inform the co-production proposal development for each of the 9 funded research projects. So our action was we got active and we co-facilitated a national online workshop where we engaged with women, and they were from consumer-led organizations, and they were from women's health peak bodies, and they were all relevant to the 9 key health priorities of the network, the research network that I was involved in. So through this, there was group discussion, there were breakout rooms and online interactive whiteboards, as you can see here. And this all captured ideas and thoughts. And then out of that, there were 10 proposed criteria that emerged, and the project team examined the key ideas and themes. And then what happened was we got together with the researchers and our consumer advocate advisors from our consumer and community involvement subcommittee, as well as our research subcommittee. And we actually tried to rate the importance of the 10 criteria. And so after doing that, we kind of brought it down a little bit more because we saw that some were similar, okay? So we brought it down to 10.5, and you can see what they were here on the screen. And then this was subject to further review. And this was so that we were ensuring that the criteria were unambiguous and easy to understand and written in accessible language, to reach end users, so it was easily understandable. But through this process, it was actually at this stage where we made a challenging discovery. And that was that there was an incongruence between academic priority setting processes and consumer and community informed interests. And it was difficult to proceed to the next stage, which was supposed to be rating and weighting the research priorities. So from our final report, we reflected on this discovery, and we stated that our workshop did not produce specific research attributes. Instead, our workshop told us what type of research and what kinds of impacts women in the community wanted. So out of that, we were able to ameliorate that evidence using existing research results to improve healthcare. That was important to women. That equity was really important. Strives to include the voices of all women and to achieve equal health outcomes, regardless of the women's circumstances and experiences. And innovation innovates to provide new solutions. So we then engaged the services of a New Zealand software company, which is called 1000 Minds, and they were fantastic to deal with, to find out through a discrete choice experimentation approach how the general public ranked the 3 principles in order of importance. okay? So, but before we did that, we actually road tested this in several times, and we did it with our consumers within our network. We did it with our researchers on the committees. We did it with other women that we knew, that we personally knew, just to make sure it was as end user friendly as possible. So round one shows that participants found the survey confusing, so we simplified the language and reduced the rankings from 5 to 3, and you can see that the survey was too long and that it took about 25 minutes, and usually people dip out after 10 minutes. In round two, the intro page and survey were confusing, so we simplified characteristics. We also got the survey down to about 20 minutes. And then in round three, there was too much information, so we split it between the invitation email and the intro to the survey. So as you can see, we got it down to 5 to 10 minutes, which is much more doable, I have to say. And people are far more likely to complete it. So then we took that information and we went to a commercial survey company called Cint. And they recruited women to do the survey across the Australian population. So here's what women across Australia chose and prioritized in women's health in order of importance. And yay, health equity was the top of the list. And I was so pleased to hear this, that equity was the most important to everybody. The other one was using existing evidence. And the final one was innovation. So the results from this whole process, well, that included a co-written report. And that was written by myself and a project lead and a senior academic. And we wove subtle nuances together with academic rhetoric to capture the variances of stakeholder voices that participated and contributed to this process. But here are some of the reasons that why this project sticks out in my mind. I really enjoyed it. So we co-produced this project and involved women every step of the way, beginning with myself as a consumer lead, our diverse consumers sitting on our CCI and research subcommittees, women who attended our national online workshop, women from across our networks, and finally women from the general public right across this country. I worked with an outstanding project lead who engaged me in all decision-making processes. You know, we talked about this being, you know, Aaron touched on it, Richard touched on it as it being a challenge. It wasn't a challenge with me in this project. That project manager considered me her peer. She honored the reciprocity of ideas that we shared. And most importantly, we experienced partnership building and relationship building, and that professional relationship was enhanced by that. And it exists today because of that experience. Working with 1,000 Minds gave me terrific understanding around how useful software packages can be in engaging and prioritizing consumer choices. Good leadership is invaluable at times. I'm sure that you'd all agree with me on that one, especially when you're stuck. And we had a chief investigator who helped solve a problem for us in about a nanosecond. And in doing that, highlighted that agility is really important. So don't let changing tack throw you off if it's required. Be ready to change when change is required. I was also able to recruit some consumers from the workshop that we held, which was fantastic. So they sit on some of our committees today. And the other thing that Richard touched on too was that tensions can arise from time to time in the partnership space between consumers and researchers. Researchers are challenged with learning how to work with consumers or just how to do their work differently. It's completely understanding that it's such a major departure from traditional methods. So I'm going to leave you with this last paragraph from our report, which I think captured much of what I've said today. So we co-shared project management, we co-shared priority setting processes, We co-shared project review processes and upheld consumer contributions across the entire project. And as these approaches encapsulate what shared leadership and shared decision-making truly are, we consider co-production to be not a project, but rather a process. And ultimately, I will say, it's all about new learnings, but more importantly, it's about making these new learnings stick. So my role as the consumer partnership lead continues with the projects that have commenced. And I was brought in with 2 other consumers to critique the application for each one of the grants. So we kept the consumer voice going in there. I have provided support to consumers and also to researchers who feel that they haven't been supported in the space. And maybe for consumers who needed to maybe fully understand the processes around co-production and the grants. And I continue to provide that support to researchers as well. From time to time, we all slip into old habits of singular leadership rather than shared leadership. So I'm there to, as that yappy little terrier almost around people's ankles to remind them and say, hey, this is what co-production and co-design is all about. And it helps to quell misunderstandings between consumers and researchers and build their relationships. So I'd just like to say thank you to everybody today for listening to me and invite your questions.